Here we are looking at compact bone, and specifically the whole entire structure that we see in the field of view here is the osteon. And the osteon, or the Haversian system, is considered the structural and functional unit of compact bone, meaning that this is what compact bone is made up of, are all these individual osteons. Now there are many parts to the osteon that you need to know, and again we would only see this with compact bone, we would not see this with spongy bone. And the first is in the middle here, which is your central canal. Now the central canal is where we find our blood supply, arteries, veins, and as you can see here, the nerves as well. And this is kind of the lifeline of the osteon, because there are cells within the bone that need this blood supply, which we'll talk about in just a moment. You'll notice these spaces right here. These are called lacuna, or sometimes referred to as lacunae. The lacuna or lacunae are spaces where these cells right here in blue would be found. And these cells in blue in this model are referred to as osteocytes. Now osteocytes are what we would consider to be mature bone cells. And you'll notice that there are little canals that are running towards the central canal, these little creases here. And over here you see it in red, because what the red is representing is the blood. The blood is flowing essentially from the central canal to these cells so they can live. And so these little canals right here that are allowing blood to flow through them are known as the canalicules. Canalicules. You'll notice around the central canal there are multiple layers of bone matrix, and you can see them kind of in different colors here, kind of like rings around a tree. These are known as lamella. Lamella are layers of bone matrix around the central canal, which essentially the layers that make up the osteon itself. Now, just want you to be aware, if we take a look at this model right here, this is the compact bone. These are smaller osteons, as you can see here. And so I wanted to show you this so you get an understanding that when you look at compact bone, the reality is there's hundreds to thousands of these osteons that are making up the compact bone. And if we tilt this to the side, you're going to notice here a really good blood supply. The arteries here, the canals that are running vertically, I should say, with blood in them, these are your central canals. And then there's one that runs perpendicular to that right here. And this canal right here is known as the perforating canal, or the Volkmann's canal. This is with blood flowing through it. If I go over to this side, you can see there is no blood flow through it, because technically we're not looking at a blood vessel here, we're actually just looking at the canal. This is the perforating, or the Volkmann's canal. Alright, here are the cranial bones. The first bone right here is your frontal bone, which is basically your forehead area, region, if you will, the frontal bone. Just in back of that, we have the parietal bone, and you notice there is a joint, a suture that runs through there, but regardless, we don't do the right and left, it's just either side is going to be the parietal bone itself. And then we have the temporal bone, and this is going to be your busier bone out of all of them with the different parts to it. So off of this temporal bone we do find the auditory acoustic meatus, or auditory meatus, and this is basically your ear canal without the tissue, the skin. We have the zygomatic process that comes off here, not to get confused with the zygomatic bone. So this is the zygomatic process. Then just behind the external auditory meatus right here, this is the mastoid process. So if you put your finger right behind your ear and push down, you'll feel this hard bony piece. This is the mastoid process. Deeper to that, we do have a very thin process. This is called the styloid process. And the styloid is referring to the stylus, which is the end of your pen. This one you can't palpate, there's too much soft tissue on top of that. And then just in front of the external auditory meatus right here, there is a shallow depression called the mandibular fossa. Fossa is referring to a shallow depression. This is where your mandible will join into place right there. Next we have the occipital bone. or excuse me, I think we're going to go to the sphenoid bone, or the sphenoid bone. Right here you can see the sphenoid bone on the outside of the skull, and that would be on both the right and the left side. And if you take off the skull, you can also see the sphenoid bone in the center of it right here, and it looks like a butterfly or a bat bone. And there is one part of the sphenoid bone right here that you need to know. It looks like a saddle called the sella turcica. Sella turcica. Then we have the ethmoid bone, and this is the only area that I would expect you to know where you would find the ethmoid bone, is on the inside of the skull like this. And then you have the cribriform plate, which is a very porous structure here. Your sensory receptors of your nose actually hang down through this very porous area of the ethmoid bone. And then you have the occipital bone, which is the bone of the back of your skull right here. You can ignore this suture line here. The whole thing is the occipital bone. And the occipital bone then also goes underneath the skull here, if you will. And there is a hole. And the word foramen in anatomy class refers to hole. And because this is a large hole, we call it magnum, the foramen magnum. And your spinal cord runs through this hole. On either side of the foramen magnum, you have these very smooth articulating surfaces here. These are called your occipital condyles. Condyles referring to a smooth articulating surface, and remember, articulating is referring to joining. And your first vertebrae is going to join and connect to these condyles that you see here. And those are the bones of your cranium. Okay, here we're going to take a look at the facial bones of the skull, and we first start with the mandible. The mandible is the lower jaw, and we do have two parts of the mandible that you need to know. We have the ramus, which is this section right here of the mandible, and ramus is referring to arm-like, and so this is kind of like an arm-like extension right here. Just this area that I'm putting the pointer over is the ramus. Then we have the mandibular condyle. If I pull this down, you'll see this smooth surface right here at the very top. This is called the mandibular condyle, and it fits up into the space right here called the mandibular fossa. So we learned about the mandibular fossa before in our earlier section here. This is the mandibular condyle, fits with the mandibular fossa. Next we have our maxillae, and our maxillae is our bone of our upper jaw, as you can see right here. And we have the palatine bone. In order to see the palatine bone, we have to look at it from underneath. Basically, the palatine bone is making up 1/3 of your palate, as you can see right here. Next we have the zygomatic bone, which is also known as your cheekbone right here. And you have one on each side, zygomatic bone, not to get confused with the zygomatic process that we learned about in our earlier section. This is a zygomatic bone. Next we have the lacrimal bone, and this is the only bone that we will actually review on the inside of the eye socket right here. And the lacrimal bone is right here. It's a very tiny bone. Sometimes you'll see a little hole associated with the lacrimal bone, as you can see right here. Basically, that little hole is where your tears run through down into your nasal cavity. And so this is the lacrimal bone. Next, we have the nasal bone, which is right between the eyes. This would be the nasal bone. We have the vomer bone, which is the bone situated in the nasal cavity. It divides the nasal cavity into a right and a left half. You can see the vomer bone right down here at the bottom. And then finally we have the nasal conchae. And the nasal conchae are the bony shelves that are coming off the side of the nasal cavity here. You can kind of see them, and you would see that on both sides. So you can see this on the opposite side as well. These are the nasal conchae, and they are bony shelves that are found on the inside of the nasal cavity coming off. those are the bones of these are the facial bones of your skull. Okay, here we are looking at the vertebrae and the different parts to the vertebrae, and then we'll go on to look at the different groups of vertebrae as well. And so our first item here is the body of the vertebrae, which is right here. And this is the thickest portion of the vertebrae, as you can see. And what sits on top of there are your intervertebral discs that sit on this body. Next, we have the vertebral foramen. So if you remember in our definitions, foramen means hole. So this is the vertebral foramen. This is the hole in the vertebrae, and your spinal cord runs through this foramen. Process, remember process is anything that sticks away from a part. So we have several of them here, and the first one is our spinous process. This sticks outward, and so if somebody were to bend over and you were to see their spine, really what you're seeing is this spinous process right here. It sticks outward. And the two that stick laterally are your transverse processes, as you can see them right here. The lamina is going to be found right here between the spinous and the transverse process. And again, the disc would sit on the body, which is made up of fibrocartilage, which we looked at in class. Now, those are the different parts of the vertebrae. Let's look at groups of vertebrae. Our first group is the cervical vertebrae right here. And what you're automatically going to notice is it has some extra foramens right here, because the cervical vertebrae are the only ones that have extra foramens. So if you do see the extra foramens, and if I ask you to name the group that this vertebrae would be found in, you can see that this would be cervical vertebrae. So cervical is around the neck area, and you'll notice in your lab packet that there are 7 of them, and 2 of them that we want you to know more specifically as well, and that's the atlas and the axis, C1 and C2, and notice they are in alphabetical order as well. So our first one here, atlas, this is the atlas. So you can see the extra foramens here, but what you notice is there's not much of a spinous process at all. This is your very first vertebrae, just underneath your skull. Your second one is your axis right here, and your axis has the extra vertebrae or foramens as well, but what you'll notice, it has this little bony piece that sticks up known as a dens. And so how this is situated, this is C2, so C1 has to go on top of it like so, as you see here. And that little dens sticks up enough where this is where your skull is rotating around, essentially, around that little dens, this little pivot point for it. So again, this is your atlas and your axis. This is C1 and C2. Do you need to know those specifically? And the group of vertebrae that we're looking at right here is the cervical vertebrae, and there are 7 of those. Now if we go beyond the cervical vertebrae, this is the one we were looking at earlier, this is your thoracic vertebrae. And thoracic is found in your thoracic region of your body, and there are 12 of those. And they don't have extra foramens, but it is a little bit bigger than the first one, the cervical vertebrae that we saw earlier. So we have our cervical, 7, thoracic, 12, and then we have our lumbar, which is going to be our thickest one here, and there are 5 of those. So you can see how thick this is. Lots of big processes that come out. So you eat breakfast at 7, lunch at noon, and dinner at 5, to remember the order of these vertebrae. Now, the next vertebrae that you see in your seat, the sacrum and the coccyx, these are fused together. And so here is your sacrum right here, all of this that you see in the field of view, and this is about 5 bones that are fused together. They don't come apart. And this is known as your sacrum. This would basically be between your buttocks. And then at the very end, you see this little tail right here. This is your tailbone, but known as your coccyx. You don't want to be using tailbone because that's not in your lab packet, but this is anywhere from 3 to 5 bones that are fused together. And these are a review of your vertebrae. Here we're reviewing the sternum in the ribs, and the sternum, we probably know it as one whole bone. The reality is it's 3 bones that are fused together. And so our first bone is on the very top. This is the manubrium. You can see the line here. And the manubrium is the very top bone. The middle bone is the body. And the last bone sticking out is the xiphoid process because it's sticking outward. Now we do have true ribs and false ribs. The difference between them is true ribs directly connect to the sternum, and false ribs do not directly connect to the sternum. So we have 7 true ribs and we have 5 false ribs if we look just on one side. So you can count with me. Here's 1, 2, 3, 4, 5, 6, and 7 true ribs. Now these 3 right here, they're actually connecting to this last true rib. So these 3 would be false ribs. They're connecting there, and then they go on to connect to the sternum. So these are false ribs because they don't directly attach to the sternum. And there are 2 others that you don't see on here that we call floater ribs. And they are kind of separate from the rib cage itself. They're not really associated with it, and they just kind of, they're attached to the vertebrae, but they're not attached to the actual thoracic rib cage at all. All right, here we will be running through the appendicular skeletal system, which would include the bones of the pectoral girdle, your shoulder area, the bones of your arm, and the pelvic girdle, and the bones of your leg. So we'll start and just work our way down. What you see here is your clavicle. You probably know this as your collarbone. You have 1 on each side, and it is shaped in the position like an S, if you will. And next we have your scapula. Your scapula you might know as your shoulder blade. This has several different parts to it. The first is the glenoid cavity, or the glenoid fossa, right here. And this is what our very first bone of our arm is going to connect to, or articulate, or join. And this is your humerus. You can see where that would be positioned. We'll look at this bone in just a moment. Next we have the spine of the scapula right here. This is this ridge that we see running right here. This is the spine. If you follow it all the way to the very end right there, this is called the acromion. It's actually technically the acromion process. I know in your lab packet it just says acromion. That's fine. But the spine, if you just follow it again, it goes right to the edge. So this is pointing outward on your body, okay? This is all in the back, the posterior side, and this is pointing out. So if you put your finger right on the edge of your shoulder and you feel a really hard piece right here, this is what you're actually palpating right there. So our first bone of our upper arm, and the only bone of our upper arm, is this one right here called the humerus. So in the upper arm you only have 1 bone. Let's take a look at this. The humerus has a rounded edge to it on one end, and this is called the head of the humerus. And there is what we call a greater and a lesser tubercle. Okay, so we have to look kind of close at this one. I'll zoom in here. You'll notice on higher here, there's a little bony piece that sticks up a little bit more, and then down here, a little harder to see, this is one that sticks out just a little bit lower. So you maybe see it better right here. So this up here, this little bony piece that sticks out, this is the greater tubercle, and the one down here is the lesser tubercle. So one is higher than the other, and there is a little groove that runs through them, and this is called your means between, tubercular groove. So this is all on the proximal end, closer to the point of attachment here to your shoulder. If we go down to the distal end here, you'll notice in the back there is a little shallow groove, a fossa. So a fossa is a shallow groove. This little shallow groove is known as the olecranon fossa. I'm going to zoom out just a moment here, and on your lab packet I'm going to skip the radius and go to the ulna. The ulna bone has a U shape to it, so it's easy to remember. Ulna for U, or U for ulna. And what we're going to see here is this olecranon fossa we were talking about. The ulna connects to it and creates your elbow joint, as you see. So this is why we're covering the ulna right now. Now the ulna has a few different parts to it as well. The first is the olecranon process. The very end right here is the olecranon process, and this fits with the olecranon fossa, as you can see. at the distal end right here, we have a little bony piece sticking out. This is the styloid process. So this is down by your wrist, okay? Styloid process. It's a little bump. If you actually run your fingers down your wrist and you feel it right before your wrist, you'll feel a little bump right here. That's your styloid process. Now your ulna sits on the medial side of your forearm, okay? And on the lateral side of your forearm sits this bone right here, which is our next bone called the radius. So they do sit somewhat like you see here in the video. Now the radius, we'll take away the ulna for a moment. The radius doesn't have an R-shaped end to it, but it does have a little button top, a little mushroom top to it. As you can see, it is kind of unique, easily identifiable. And you'll notice this very large lump right here. This is called the radial tuberosity. And just remember that all these little landmarks that we're going over are all things that you'll probably be getting more comfortable with as you go through your programs. These are all landmarks for muscles and tendons and ligaments to attach to. At the distal end, it too has a styloid process, excuse me, and you can see this is the other styloid process. So, kind of put those together. Probably be better if we put them this way here. And what that brings us to are the bones of your wrist. See here, the bones of your wrist, which are what we classify as short bones because they're chunky. These are known as your carpal bones. The bones of your palm is your metacarpals. And finally, the bones of your fingers at the very end are your phalanges. Next, we'll take a look at the pelvic girdle. All right, here is the pelvic girdle. The whole entire thing that we see here is the pelvic girdle. And the pelvic girdle is held together by some bones and some joints. And the first bone that we'll look at on either side, this very large bone that goes all the way down, is known as the coxal bone, or also known as the os coxa. So a pelvic girdle has one os cox over here, one over here, and this is like the sternum, meaning these are three bones that are fused together, which we'll look at in a little bit. Now the joints that are holding this pelvic girdle together, the first one is called the sacroiliac joint, as you see right here, and this is on both sides, this line right here. And this is obviously needed to create this pelvic girdle. The other joint is in the front here, which is the pubic symphysis. So again, if you didn't have these joints, this would be broken apart, so very important that we review those joints and understand it. Now, distinguishing between males and females, there's several ways to do this. One is, and the one that I want you to know is this pubic arch right here. So the pubic arch in the female is very wide. It's greater than 90 degrees. And we would say that this is kind of shaped like a U. And if we look at a male, you'll notice the pubic arch is narrow, so it's less than 90 degrees. And here it is shaped like a V. And that would be the difference between male and female. Now, what we need to do, though, is we need to look at the coxal bone separate from the pelvic girdle. So here is the coxal bone when it's not part of the pelvic girdle. And like I said, the coxal bone is made up of three bones that are fused together like the sternum. And the first bone is the ilium, right up here. It is the largest one. It is shaped very flat. At the very top of it, there's this little ridge right here. This is called the iliac crest. Okay, the iliac crest. And if we follow it towards the back, we get this really big notch right here. This is called the greater sciatic notch, so your sciatic nerve runs through that area. Now from this point down below on this side, this is going to be the ischium bone. Once we get past the greater sciatic notch, we are now part of the ischium bone. And the ischium bone has several parts. The first one is the ischial spine, as you see right here. That kind of sticks out a little bit. And then we go further down, and this thickening right here, this is called the ischial tuberosity. This is what you're sitting on. This is your butt bone. This is what you sit down on. This is why it's so thick too. And in the front right here, it's a very small bone called the pubic bone, which, as you can see in your lab packet, does not have any parts to it, or the pubis bone. So really this is separated right here. The pubis bone is separated from the ischium, going directly down the center here, and then you have your ilium up at the top. And this socket right here is called the acetabulum, and essentially the acetabulum is where all three bones are actually fusing together right there. And if you look in your book, you'll notice a picture of it in color, which makes a little bit more sense. Now, our first bone of our leg is our femur bone right here. Let's take a look at the femur bone. Now, the femur is your largest bone in your body, and has somewhat like the humerus in a way, but more pronounced. It has a more pronounced head, as you see here, and where it narrows, we have the neck. On the back side here, we have, instead of tubercles, we call these trochanters. So at the very top, it sticks up more. This is your greater trochanter, and then down below is your lesser trochanter. So remember, we had tubercles on the humerus. Here we have trochanters, much bigger muscles down here as well. Now, if we go down to the bottom here, you'll know these smooth articulating surfaces known as condyles. And you have a medial and a lateral. And so if I point to this one, it's a little hard to see, but this one right here is your medial condyle, because your head is always going to be pointed medially towards your body, because this is where it joins. So this would be your medial condyle, and the one on the outside is your lateral condyle. These condyles are smooth articulating surfaces. Now, what joins to the femur bone is our next bone called our tibia. Let's take a look at the tibia. First thing we'll start out with the tibia is the tibial tuberosity. And you see this little bump right here. This is the tibial tuberosity. You could add, this is in the front of your tibia, so if you actually take your hand and run it down past your knee joint, you'll feel a little bump right there. If we look down at the distal end, we have what looks like a styloid process, but we don't call them styloid processes down here. We call these malleoluses. This is called the medial malleolus. Your tibia sits on the medial side of your lower leg, and so this is the medial malleolus. This is a little bump, a little round section near your ankle that you may hit on different furniture, and causes you a lot of discomfort at times. Now, the tibia also has condyles right at the top here, smooth articulating surfaces. One's medial, one's lateral. And how will we know which one is which? Well, if you know this is the medial malleolus, this side here has to be the medial condyle, and the side away from the medial malleolus is the lateral condyle. So again, the malleolus is going to determine which side is medial, which side is lateral. So this is medial, and then we have the fibula, which is going to be lateral. And the fibula is very thin in comparison to the tibia. The only part that we want to know is the rounded edge at the bottom too, which is your lateral malleolus. This is the other round portion of your ankle area. Now, the knee joint, in front of it, there's a bone, which is the patella bone. You guys might know it as your kneecap, and there it is. It's a square, short, classified as a short bone. It sits right in front of your knee joint. That's your patella. And finally, the bones of your ankle are known as tarsals, and you need to know that this is the calcaneus, this is the heel of your foot, and at the top of it is your talus. So these two you need to know specifically, otherwise collectively together they are the tarsal bones. The 5 bones at the sole of your foot, this would be your metatarsals, and then finally the bones of your toes are your phalanges. Next, we will review the knee joint. Here we are looking at the knee joint, and we start out with the medial and the lateral meniscus. Now, I'll kind of pull this down here, you can see this, but sitting on top of your tibia are these C-ring shaped areas right here. These structures here, they're in the shape of a C or a crescent. These are known as the meniscus. We have a medial and we have a lateral. Now, how do I know this one's lateral? It's closer to the fibula, and the medial here is away from the fibula. So this is your medial meniscus, this is your lateral meniscus. They sit right on top of your tibia, and they're in the shape of a crescent, hence the name meniscus. Next we have the anterior and the posterior cruciate. So anterior means in the front, posterior means in the back, cruciate means crossings. These two are going to cross one another. And remember, a ligament is connecting bone to bone, and a tendon connects muscle to bone. So this is the front of the knee here. So this ligament here is connecting the tibia to the femur, and this is the anterior cruciate ligament. And you can see crossing it in the back, this is your posterior cruciate ligament. This also connects the tibia to the femur as well. You can see how those two are crossing, one in the front, one in the back, but crossing one another. Then we have our medial and our lateral collateral ligaments. So these are going to be on the outside of the knee right here. So here we have the because it's on the side of the femur, fibula, this is going to be your lateral collateral ligament. And this one, because it's away from the fibula, this is your medial collateral ligament. So all these ligaments here are to keep this knee joint nice and tight and not loose, and allows you to actually walk. Next we have the patellar ligament versus the patellar tendon. I will show you this one here, which best represents that. So remember, a tendon connects muscle to bone, and a ligament connects bone to bone. Now what we're looking at here is the central point of focus here is right here, because this is the patella right behind here. You don't see it, but it's there. Remember, the patella is the bone, it's the kneecap. So a muscle connecting to this patella, this area right here I'm pointing at, this would be your patellar tendon, because it's connecting muscle to the bone. Down below here, when I go below the patella right here, this is the patella connecting to the tibia, so this is bone to bone. This would have to be a ligament. So this is going to be your patellar ligament. So patellar tendon on top, patellar ligament on the bottom. Again, it's all focusing around that patella because that's what it's actually attaching to.